Today, I'm going to talk about two of the largest bills you can see in the world. The first one, you go to the zoo and you see the Australian pelican. It has the largest bill of any bird. It can be 18 and a half inches long. And then, if you want to see the largest medical bill, go to an out-of-network provider. You can end up with bills tens, if not hundreds of thousands of dollars if you're not careful. I want to talk about ways you can avoid those large out-of-network bills in this episode of Healthcare Hacks. Hi, my name is John. I'm your healthcare hacker and a bill expert. Before we get started today, please take a minute. It's just really important. Smash that like button. Give us a thumbs up. Follow us on your favorite social media platform. Subscribe to our channel. We want you to stay up to date with our most recent content around how to navigate the U.S. healthcare system, and we want to reach as many people as possible because we think this is very important. So out-of-network bills are the scourge of the U.S. healthcare system. They're really easy ways that you can end up with incredibly large bills. And today we're going to talk about how you can avoid them, and then if you can't avoid them, what you can do about it. So first, the easiest way to avoid them, and probably the one we least think about, is selecting a health plan that you're less likely to have out-of-network care. So when you look at your health plan in open enrollment and you're choosing, most people look at premiums or deductibles or co-insurance copays. Too often people don't look at the network and who's in network and who's not in network. What you want to make sure is the doctor, hospital that you're most likely to seek care at is in network. If it is not, you probably should choose, even if it's more expensive, a different health plan that has those providers in network, because if you don't and you end up needing care, it can be dramatically expensive. The next step in prevention is when you do seek care, avoid out-of-network providers. And this is a matter of checking. And the best place to check is with your insurance company. Most of them have pages on their portal where you can log in or you can call and ask if that provider is in network. Again, if they're not in network, I would avoid them if at all possible because it can end up being very, very expensive. Now, there's unfortunately times you just can't avoid using an out-of-network provider, or you don't have any choice in what provider you see. Maybe it's a case of an emergency. You're traveling and something happens and the nearest hospital is not in your health plan's network. It happens. What you need to make sure is how your health plan is going to adjudicate that claim or handle it. First, you want them to handle it in-network or roll up through in-network benefits, so your deductible, co-insurance, etc. Secondly, you still could get billed by the provider, even if it's treated as in-network. So what you want to do is ask your health plan to please try to set up a one-time negotiated rate. It's called a case rate, typically. That way, you can be billed more than the agreed-upon amount between the hospital or doctor and the insurance company, and it'll roll through your benefits. That's the best way you can do it if you absolutely don't have any choice about where you go. So if a hospital doctor that you want to visit is not in network, but you still want to see it, what are your options? Well, the first one is you can file for a network gap exception with your health plan. This is basically stating, hey, for this service, there's nobody within a certain radius from my house that can provide this level of care. So for example, I might need a knee replacement and there's no orthopedist within 30 miles, and therefore the person I want in their network, so therefore the person I want to go to, they may cover. Now, what they won't cover is if you want to go to a world expert or somebody my friend recommended, just because I think they're really good, and the doctor in network maybe isn't as good. That won't fly, right? The health plan is going to say you went out of network on choice. And if you go out of network by choice, again, you're going to end up with a very, very expensive bill because while the health plan might cover some of it, there's going to be a significant portion that the provider will bill you directly that will not be covered that can end up with, as I've seen, as high as several $100,000 in bills. So if you really want to see a doctor that's out of network and you think that they're the only doctor or hospital within a 30, 40, 50 mile radius, again, that varies by health plan, ask for that network gap exception. It's an easy way to get it covered as if it was a network. Well, this touches upon out-of-network. There's more to come on out-of-network care. The big point and the big takeaway is, if at all possible, avoid going to an out-of-network provider. It's going to be far cheaper if you can stay in network. So ask the question and make sure that your doctor, the hospital you're visiting, isn't out of network. If you have any questions about the content in this episode, please leave them in the comments below. We'll try to address them in a future episode of Healthcare Hacks. And as always, make sure you get the facts by joining me in the next episode of Healthcare Hacks.